In today's video, we'll be discussing about hyaline change and myxoid change. Our learning objectives: to define hyaline change and myxoid change, to know the clinical significance of these conditions with a few examples. Hyaline change and mucoid change or myxoid change are morphological effects of cell injury. The earlier term used for these conditions was degeneration, which is no longer used. Hyaline change. Definition: it's a descriptive histological term for glassy, homogeneous, eosinophilic appearance of material in hematoxylin and eosin stained section and does not refer to any specific substance. So it's just a morphological change we observe under the microscope in a wide variety of conditions. The common characteristic here is the appearance, which is homogeneous and eosinophilic. What are the types of hyaline change? Intracellular hyaline change, hyaline droplets in proximal tubular epithelial cells, hyaline degeneration of voluntary muscle, Zenker's degeneration seen in infectious diseases, Mallory's hyaline inclusion seen in hepatocytes and alcoholic liver injury, hyaline inclusion in viral infections, Russell bodies, which is excessive immunoglobulin in rough endoplasmic reticulum of plasma cells. So within the hepatocytes, what we find here is the intracellular deposit, which is having the characteristic eosinophilic homogeneous appearance. These are nothing but the Mallory's hyaline bodies. Likewise, intracellularly within the plasma cells, what we find are Russell bodies. Coming to extracellular hyaline change, it could be hyaline degeneration in leiomyoma, corpus albicans in ovary, hyalinized old scar of fibrocollagenous tissue, hyaline arteriolosclerosis in renal vessels in hypertension and diabetes mellitus, hyalinized glomeruli in chronic glomerulonephritis, corpora amylaceae in prostate. So again, what we find here is leiomyoma with smooth muscle cells, and this material here, which is again homogeneous eosinophilic, is the hyalinized change. What is mucoid change? Mucoid change, also called as myxoid change, means deposition of mucus-like material. Mucus is the secretory product of mucus glands and is combination of protein complexed with mucopolysaccharides. Mucin is produced by epithelial cells of mucous membrane, mucus glands, and connective tissue such as ground tissue of umbilical cord. Coming to myxoid change, examples: epithelial mucin, catarrhal inflammation of mucous membrane of respiratory tract, alimentary tract, uterus. So you have to remember the amount of mucus we produce in the respiratory tract when there is common cold, or it could be in the alimentary tract, or it could be the uterus, the cervical mucus. Obstruction of ducts leading to mucocele in oral cavity and gallbladder, cystic fibrosis of pancreas, mucin secreting tumors commonly seen in ovary, stomach, and large bowel. So what we find here is an ovarian tumor lined by columnar epithelium with apical mucin imparting a bluish tinge. Coming to connective tissue mucin, mucoid or myxoid degeneration can be seen in some tumors such as myxomas, neurofibromas, fibroadenoma, soft tissue sarcoma, dissecting aneurysm of the aorta due to Erdheim's medial degeneration and Marfan's syndrome, myxomatous change in the dermis in mixed edema, myxoid change in the synovium in ganglion on the wrist and in the ligaments, benign tumors such as pleomorphic adenoma. Remember the pseudocartilage in pleomorphic adenoma? That's an example of myxoid change. So this is a neural tumor. We have the wavy nuclei here and the bluish material here, bluish tinge to it, is because of the myxoid material. Likewise, this is a myxoma commonly seen in the atrium. It has the bluish tinge to it because of the mucoid deposits. To summarize, hyaline change and myxoid change are forms of cellular injury. Hyaline change is a descriptive histological term for glassy, homogeneous, eosinophilic appearance of material in HND section and can be intracellular or extracellular. Mucoid change means deposition of mucus-like material which is secretory product of mucous gland or combination of proteins complexed with mucopolysaccharides. These are my references. Thank you.